Good afternoon. Today's March 26th, and I hate to be the bearer of bad news, but I am. We have a positive COVID-19 test in our community. We are prepared for this, and we've been preparing for this for over a month, and we've had our incident command set up since the 15th. It doesn't make it any easier when it happens and it hits home. We have tests for COVID-19, and we will be able to administer those tests, but we will only test patients who have exposure and have signs and symptoms, of which Eva from County Health will go over in a little bit. For the meantime, if you believe you have any exposure, please stay at home. The community is counting on you. I really need the public to do their part. We are here to try to care for you, and we need the public to do their part as well. So I urge you to do any kind of curbside service or delivery service and stay at home. Eva, do you mind talking a little bit about how people can protect themselves when they're at home and the guidelines?
Yep, so we kind of shifting gears today to steps to prevent the spread of COVID-19 if you are sick. So if you feel like you have symptoms to that, you need to go home and you need to stay home except to get medical care. We have on the fact sheets that we have sent out on a daily basis where the phone numbers are for if you feel like you have symptoms for that, which is Mountain View Medical Center at 547-3321. You can also call County Health on Monday through Thursday, and that number is 547-3234. You want to separate yourself from other people in your home. This is known as home isolation. Stay away from others as much as possible. Try to have a sick room that others do not use, a separate bathroom if that's possible. Call ahead before coming to the doctor. We can't stress that enough too. We need to be prepared on our side for you, and we also need to help screen you over the phone so we have all the information that we need. You can wear a face mask at home if you are sick. We are still working out some systems on that of how we're going to get those distributed, or if we're going to look into the homemade kind of masks at this point. So we will get more information on that. If you're caring for others, we also recommend a face mask and try to limit exposure to those people. Cover your coughs and sneezes. That goes for everybody, whether you're sick or not. Dispose of used tissues in a trash. Wash your hands. That's probably the biggest two things I will tell you is stay home if you can and wash your hands. There's not a need to go out every day, to go to the grocery store, to go to the post office. We all really need to try to do our part right now and limit exposure. Hand sanitizer is also an option when you can't wash your hands, but soap and water is best. Avoid touching your face. Avoid sharing personal household items. Don't share dishes, drinking glasses, cups, eating utensils, towels. Clean all surfaces thoroughly with disinfectant. Monitor your symptoms. So call before you come, as we've said, if you think you've had an exposure to COVID-19 and you have the symptoms of fever or cough. Those are the two biggest ones at this point. Sore throat is also one of them. Call 911 if you have a medical emergency. Our EMS is also trained and prepared to help handle these situations.
So I want to remind the community that we've been preparing for this, and we are prepared for this. We have a lot of systems in place, and we are trying to get information out to the best of our ability. If you need information, you can go to our website, www.mvmc.org. You can call our main number, 547-3321. And we would like to do a Facebook Live event tomorrow at 3 p.m. to answer questions. We're trying to predict what questions may come and try to get those to you in these videos, but we'd like to make sure we get everyone's questions answered. We don't want anyone to panic. We don't know exactly how far the reach is as far as the exposure. Any clinic patients that came into our clinic this week, you will get a call directly from us today. And the time now is about 2:15, so you will get a call from us today. If you have any questions, call us. We will try to answer them the best that we possibly can, and we look forward to speaking with you tomorrow at our live video at 3 p.m. And we will host that at the county health page. Is that right, Eva? Can we do that?
Sure, yep.
Okay.
I have one more thing to add.
All right, perfect.
One more thing to add that I did forget, and I'm sorry. Dr. Brunson, my health officer for public health, was involved in these conversations that we've been having today. Her recommendation at this point is that daycares should be closed at this time. It is a strong recommendation from her and the health department. Thank you.
As a reminder, if you have any feelings of being bummed out or sadness, please reach out to our mental health provider, Jen Hurwitz, at 547-3888. I can't urge it enough that you need to take care of your mind, body, and soul enough during these times. Please reach out if you need any help, and I would like to let everyone know that the hospital is open, our ER is open. We are going to have our clinic closed for today, the 26th, and the 27th tomorrow, as we sort through all of the things that we're going through right now with this result. Please stay tuned for our live broadcast tomorrow at 3 p.m.